Hi everybody, today I'm going to be talking about the impact that parental involvement has in pediatric care. In pediatric care, decision-making significantly enhances patient outcomes by fostering better communication, improving adherence to treatment plans, and reducing emotional distress for both the child and the family, making it a critical component of effective pediatric nursing practice. Emotional support for their child. Children often feel more secure when their parents are actively involved in their care. The presence and involvement of parents can reduce anxiety and foster a sense of comfort during medical treatment. Parent involvement helps the child feel valued and heard, particularly in cases where children can express their preferences. It's important for a parent to also respect how a child may feel about something. For instance, if a child, that knows what's going on, a young child or a little bit older of a child knows what's going on, and they prefer, they don't want to get a certain surgery, or they don't want to, undergo more treatment, it's important for the parent to hear the child and also take into consideration how that child may be feeling. It's important for parents to also be active in any decision making for their child and not just kind of be blow it off. It's important for parents to be having communication skills, especially with the physician, asking questions, making sure everything is exactly how it needs to be for their child, and also be the child's vouch for their child. Parents provide critical information about their child's medical history. It's important to have good communication, symptoms and behaviors that nurses and doctors might not otherwise observe. If a child is a certain way, obviously a doctor isn't going to know your child better than you, so it's important for you to share symptoms. And if you notice your child's not being himself, it's important that you speak up and communicate with the doctor. There is also certain challenges that may arise with a parent and a doctor. Disagreements, everything obviously isn't perfect. Parents may also have a lot of stress and feeling overwhelmed with medical decision making and responsibilities, which can also hinder their ability to contribute effectively. If they feel too overwhelmed, not understanding something, it's important also for that doctor to make sure that the parent is very clear on what is going on, but also for the parent to vouch for their own child. That's all I really have about impact and parental involvement. I feel like most parents are involved in care, especially for their young child, but you would also be surprised. Yeah, I hope you guys enjoyed.